Well, there are kind of two levels to that question about who's a good candidate. There's right now, there's this stage of research, there are very strict criteria. So we have outside physicians doing physical exam and lab work and EKG to make sure there's no medical reason why it wouldn't be okay. And then we have outside psychologists doing psychological testing and determining their level of PTSD symptoms. So it's kind of a very formal process in the research. In clinical practice, I think it's a matter of, do they have any medical contraindications? And also, are they, are they okay to be off other medications? Because we do taper people off psychiatric medicine. So if we had somebody with, there's some psychiatric illnesses where they might not be able to get off their medicines. And at least at this stage, we wouldn't enroll those people. But most people, we see people that have been on antidepressants and lots of other medicines, and we taper them off. But for instance, if they had bipolar type 1, manic depressive disorder, and they wouldn't be stable off their medicines, and that would be somebody that this wouldn't be suitable for. If people have psychosis at this stage, that we would not include somebody like that. Going forward in the future with more research, maybe that won't always hold true, but that's the way it is now. So somebody has to be, stable enough to be able to manage going into this deep process, and they have to be willing. We do very careful informed consent. So we want people to know this process is different. It doesn't suppress your symptoms. In fact, it helps you get at the root of your symptoms. So you might actually have more symptoms temporarily during that process. And that does happen, that people suddenly people with PTSD often go from either being overwhelmed by emotions or they're emotionally numb, cut off. And so when you start to lift the emotional numbing and process the trauma in a deeper way, sometimes that's difficult and people can have a more difficult time temporarily. So it's important that people understand that and agree, yes, I'm willing to do that because I think it might be worth it. And we prepare them for that and we support them through it. I think this is a very exciting time in this research because now, after starting to work on it 20 years ago, we now have what's called Breakthrough Therapy Designation from the FDA, meaning our data and all the studies we've done so far is so promising that as we enter the last phase, which is called phase 3, in order to see if we can get the drug approved, the FDA wants to expedite it because our data has been so strong. And so right now we're in phase 3 trials in 14 sites in North America, 2 in Canada, 12 in the US, and those are going on right now. So this has all been funded completely by non-profit organizations. So no government money, no industry money, no patents. It's all nonprofit, and that's quite remarkable to have a small nonprofit organization even get it this far in research. So it's a very exciting time to be talking about this.